So there is no apparent causative factor in this unexplained infertility, recurrent pregnancy loss. It is seen in 50 to 75% suffering from RPL. Most miscarriages are sporadic and are thought to result from genetic causes that are greatly influenced by maternal age. In patients with unexplained RPL, the chance for future successful pregnancy can exceed 50 to 60% depending on the maternal age and parity. So maternal age comes into place. When the age is below 30 years, it's always they have higher chances to get pregnant. If age above 30, it decreases drastically, and above 35, the chances are remote. What are the incidents of unexplained fertility? Maternal age is the single most important, as I said, in miscarriage happening in RPL, which is invariably a result of oocyte and embryonic aneuploidy. For example, the theoretical incidence of RPL in women less than 20 years is approximately 1.2%, whereas of women of greater than 45 years exceeds to up to 50%. So here shows the incidences of RPL compared to the maternal age. So in 20 years, it is 1 by 85. In 25 years, it's 1 by 70. In 30, it's like 1 by 30 is 1 by 45, 35 1 by 16. In 40 years of old, it is 1 by 1/4, and 45 years, it's half. Okay, half of the population will be suffering from RPL. Next. A significant number of women suffer from RPL because of chance alone. Some will doesn't have any other abnormalities, but because of chance, they'll suffer from this RPL and will not have any other identifiable abnormality other than embryonic aneuploidy. These patients are healthy women who have been unlucky in their pursuit of a pregnancy and will be diagnosed as having an unexplained RPL because their investigation will be invariably normal. So everything comes normal after thoroughly investigating, but still they have recurrent pregnancy loss. Incidents of RPL occurring by chance is 20 to 24 years age women. One miscarriage happens in 11 people, 2 miscarriages in 1.2%, and 3 miscarriages is seen in 0.13%. And so here's seen by 35 to 39 years of age, the percentage of 3 miscarriages goes up to 1.56%. So age plays an important role in this RPL. This is mainly because as age goes on, the oocyte quality decreases drastically. Next. Oocyte, unexplained RPL. So we see about oocyte. Aneuploidy is accepted as the main cause of pregnancy loss in women with advanced age. However, it has been speculated that in some women with unexplained RPL may suffer from premature ovarian aging, leading to reduced oocyte quality and quantity. In some people, the AMH value, the number of follicles which are there inside the ovary reduces in before 30 years itself in few patients. A study on oocyte donation of 8 couples with unexplained RPL who had poor response to ovarian hyperstimulation. The investigators reported a rate of 11.1% pregnancy loss in these 8 cycles and questioned whether the oocyte rather than maternal and paternal factors is the origin of RPL. So what they have done in few theories, they have taken a donor X, thinking the women are responsible for the RPL, but even though 11.1% had pregnancy loss, showing that even men are related to this recurrent pregnancy loss. Next. So as I said, in men, the sperm is also one of the factor causing recurrent pregnancy loss. The role of the sperm is unexplained RPL remains controversial, with varying original reports on factors such as Y chromosome, microdeletions, sperm oxidative stress, sperm DNA fragmentation, sperm concentration, morphology, and function. So all these are matters of sperm. Sperm quality will not be good, and it will have DNA damage happening inside the sperm. So we have to thoroughly investigate. We have a test called as DNA fragmentation test. If the DNA fragmentation test come above 35, mainly above 40%, then it mainly shows that the sperm quality isn't good. And then we can try to improve the DNA fragment. Try to improve the sperm quality by giving antioxidants and other coenzyme and other medicines for the male, or we can advise for donor sperm also. A recent systemic review and meta-analysis reported that DNA fragmentation was indeed significantly associated with miscarriage. The results concluded that using methods to select sperm without DNA damage may reduce miscarriage in assisted conception. So in what we can also advise them is that we can also advise IVF in them, because in IVF we can always have a chance to select good sperms rather than the sperms which have defective in morphology or in movement motility. We can always select the best sperms and do embryos with that. So we can always advise IVF in these cases. Next. Coming to endometrial causes, women with RPL express increased level of pro-implantation cytokines, which render approximately 40% of them subfertile. The superfertility is believed to disable the natural selection of a healthy embryos and allows implantation of poor quality embryos. Even in some patients will be subfertile, some patients will be superfertile, like they'll conceive easily one or the other month. But the thing is that superfertility will again cause to select wrong, low quality oocytes, low quality eggs, which again lead to miscarriages. This inevitably leads to pregnancy loss. Next. Systemic factors. Other than the embryo endometrial interactions, a plethora of research has focused on systemic conditions as a possible cause of unexplained RPL, such as thyroid abnormalities and particularly thyroid antibodies, PCOS, insulin resistance, hyperandrogenemia, and abnormal immunological reactions. All these I've discussed before. So all these endocrinological disorders again leads to RPL. Several studies have reported a genetic predisposition to unexplained RPL with an increased risk of siblings affected patients. So if this also runs in families, if their siblings also had a similar history, they are more predisposed to such RPL conditions. Like sisters are suffering from the same conditions, even they will have more chances of RPL. So interleukin genes are mostly commonly associated with RPL, especially 1B, interleukin 6, interleukin 10, and interleukin 18. Variants of these genes alter the corresponding protein expression levels and can therefore facilitate or hinder implantation. Next. Immune dysregulation. Maternal immune tolerance of the fetus is essential for normal implantation and pregnancy. So the mother should always tolerate for the implantations, like a foreign body, like fetus is getting implanted inside the body. So maternal immune system should tolerate with the embryo. A disruption of the normal CD4 T helper cells and uterine natural killer cells and a TH imbalance in the endometrium could lead to implantation failure or pregnancy loss. The mother itself can reject the embryos for implantation happening. Mainly in those patients, the T helper cells and NK cell activity will be disrupted. This causes autoimmune rejection of the embryo for implantation. Immunological reactions to male-specific minor histocompatibility (HY) antigens has also been hypothesized as a cause of pregnancy loss in women with secondary unexplained RPL following the birth of a boy. Okay, in some patients, in some immunological male-specific minor, specific factor also can be taken a role in rejecting the implantation happening in those patients mainly who have conceived with a boy.